Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my co-host, Nassau Community College student Keith Garbarino. And today we're talking about low vision awareness and the National Eye Institute. If you've been suffering from vision issues, you'll want to stay close to your radio and phone or whatever you're listening to right now to get the information you need. I'd like to welcome our guest, Dr. Mark Wilkinson, an optometrist and a clinical professor with the University of Iowa. He is also a chair of Low Vision Subcommittee of the National Eye Health Education Program at National Eye Institute. Dr. Wilkinson has recently been studying the benefits of rehabilitative interventions for individuals with visual impairments. He is also the author of research articles published by Optometry, the Journal of the American Optometric Association, and others. He also co-authored a book for patients, Protect Your Sight, How to Save Your Vision in the Epidemic of Age-Related Macular Degeneration. So welcome, Doctor.
Thank you. Thanks for having me.
So we just want to welcome you to Your Family's Health. Tell me, what is the difference between an optometrist and an ophthalmologist? Let's start there.
Well, I would say the primary difference is surgery. So ophthalmologists are get their medical degree first, and then have a residency of 4 years to learn to do eye surgery, where optometry does some, minor types of procedures in different states. Optometry, diagnoses and manages eye diseases, but doesn't really do eye surgery.
So how many Americans would you say are visually impaired? What is the
right
number?
Now, the estimate is there are about 3 million people over the age of 40 that are living with vision loss or low vision. That number is expected to increase about 70% to about 5 million by 2030.
So when you say age-related, what are we talking about in terms of age? Is it over 50 that we're seeing this visual disturbances?
Yeah, really more 65 and older. The big four conditions that cause age-related vision loss, of course, are age-related macular degeneration, diabetic retinopathy, glaucoma, and also cataracts, when cataracts being one that certainly can be treated, as can glaucoma, and certainly people can need to be evaluated on a regular basis if they have diabetes to avoid vision loss from diabetes as well.
So when we use the term low vision, we really are talking about specifically age-related changes in your visual ability or...
Well, actually not, acuity. Because there are lots of things that cause vision loss, and so people can have vision loss from birth, from congenital conditions such as optic nerve hypoplasia, optic atrophy. People with albinism have reduced vision, and certainly there are acquired conditions like Stargardt disease, retinitis pigmentosa, that can cause vision loss as well. So, and neurological conditions such as stroke can cause vision loss. So there's the greatest number of people with vision loss are 65 and older, but vision loss occurs from birth on.
So when you're saying, or you're using the term low vision, you're just really are talking to the individuals who need glasses or contact lenses, people who have issues seeing or problems seeing without an assistive device.
Well, what we define, that NEI changed the definition of low vision a while ago, or visual impairment, and that is that somebody who has vision loss that cannot be corrected by standard glasses, contact lenses, medicine, or surgery, that's interfering with their daily activities. So somebody who needs glasses is not considered visually impaired or have low vision. It's people who have a permanent loss of vision that's affecting their quality of life.
So are we talking about individuals who are legally blind?
Well, there's lots of people who would be considered visually impaired who don't meet the classification of legal blindness. They may have visual field loss. They may have contrast loss that's affecting their ability to function, to read, to do activities of daily living, but still would have a visual acuity or visual field greater than what is considered for the definition of legal blindness.
Okay, so for these individuals who have low vision, how do you define it clinically? I mean, and would you use this term? Mm-hmm.
Yeah, so we would say somebody is visually impaired or has low vision if their vision cannot be corrected with standard glasses, contact lenses, medicine, or surgery, and that that vision loss interferes with their daily activities. In the past, they used to use a number, 20/70, as the start of low vision or visual impairment, but we've got rid of that number a while ago because there are a lot of people who had better than 20/70 vision but had functional problems because of their visual condition. And so we really use a functional definition more, and obviously we want to make sure that the people have been treated, that they've been evaluated and managed by their optometrist or ophthalmologist to get the best vision possible. But there's many times where that vision is still reduced, and then those people are the ones who need low vision care.
So if you would have to make a distinction, would you say that most visual or low vision is affected most by health-related issues or developmental issues with aging?
Well, I would say that the vast majority of people with vision loss over the age of 65 have age-related macular degeneration. Mm-hmm. So it's a much smaller group of people, of young people, children from birth through the teen years who have vision loss, but they're certainly not an insignificant number. And then during the working years, diabetes can be a problem for many people, causing diabetic retinopathy that reduces vision, and then the conditions with aging that come on. So there's sort of a mix of causes of vision loss, from inherited, acquired brain injury things can also have that effect, autoimmune diseases, trauma, as well as these age-related conditions like glaucoma, cataracts, macular degeneration, and diabetic retinopathy.
You're listening to Your Family's Health on the voice of NASA Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at NASA Community College, along with my student co-host, Keith Garbarino. And today we're talking about low vision awareness with Dr. Mark E. Wilkinson, an optometrist and a clinical professor with the University of Iowa. He is also a chair of the Low Vision Subcommittee of the National Eye Health Education Program at the National Eye Institute. So Keith has a question for you, Doctor.
How often would you recommend someone gets their eyes examined, and how important are these exams if you claim you have 20/20 vision, and what exactly does the exam check for?
Well, I think the most important thing for an eye exam is to make sure the eyes are healthy, and this is very important because there are a number of conditions that people won't necessarily recognize that they have a problem with their vision if their eyes aren't checked. Folks with diabetes should have a dilated eye exam on a yearly basis. That's very, very important, so that we make sure that if there are changes in the vascular supply of the eye, that those are treated appropriately to prevent significant loss of vision. Mm-hmm. But really, if you think about glaucoma, that's something that most people are not going to know if they've developed glaucoma. Diabetic retinopathy or diabetic changes, they're not going to know. And so having a regular eye exam is important. Now, if there's no eye health problems, then you could just say to your eye doctor, hey, I'm seeing great. How soon should I be seen? And that frequency changes as we age. So as we get older, it's probably going to be every 1 to 2 years. Diabetics every year. Somebody who has glaucoma or cataracts probably are going to be on a yearly basis. But, if you're 20, 30 years of age and you're seeing great, you probably only need to be seen every 3 to 5 years.
We've seen a lot of advertising for people who can improve their vision with exercise. And I don't know if you've seen these commercials on TV. What are your thoughts about that?
So
Have you seen those? Have you seen those commercials?
I've seen some of these things in the past. I don't know that I've seen any recently, and I won't mention, some of the ones from before, because some of these things get recycled again. Mm-hmm. There really isn't a way that you can exercise your eyes to make the muscles in your eyes stronger, and there isn't a way that you can exercise your eyes that will take away if your eye is too long or too short, causing you to need glasses. Changing the need to wear prescription lenses, there really isn't any sort of exercise intervention that will make that better. So there's actually, one of these things came out of Iowa a few years ago, and I was involved as an expert witness in discussing this when the Attorney General went to file a lawsuit against the folks who are promoting these things.
Oh,
right. So it's a lot of stuff that, it gets in your pocket, right? And they'll probably give you a full refund if you send things back, but they charge enough money that people aren't necessarily concerned about sending things back, and so they've just it's a lot of hype.
So what is glaucoma and other eye-related diseases? You hear a lot about cataracts in older adults, and what kind of impairment does this cause?
Well, cataract is a clouding of the lens of the eye. So the lens of the eye is shaped very much like an onion, and it keeps growing new layers as we go through life. As those new layers keep laying down, eventually it causes focusing problems. So people about mid-40s will start having trouble needing reading glasses or bifocals to see things up close because the lens loses its flexibility. And then eventually the lens of the eye will become cloudy, and that's what we call a cataract. And so when you have a cataract, your vision is more hazy, more blurry, more glare at night, those sorts of things. Fortunately, cataract surgery is one of the most common procedures done year in and year out, and it's very, very successful in restoring good vision, much brighter, crisper vision after the cataract surgery, which is about a 10-minute procedure. Glaucoma is more of an optic neuropathy. So it used to be that the thought was that it was just elevation of the pressure inside the eye, but now we know it's more of a optic neuropathy problem affecting the optic nerve. It is related to the intraocular pressure of the eye, so that's one of the things that has to be checked in a comprehensive eye exam. But left untreated, it causes a loss of peripheral vision. And so it damages the nerves from the elevated pressure. And so it's important to make sure that the optic nerves look healthy, which you can really only do by having a dilated eye exam.
So we hear the terminology when the cataracts ripen, you can have surgery to remove the cataract. Is this terminology still used, or when is it appropriate to have cataracts removed?
Yeah, it's funny because people still talk about the ripe thing, and that hasn't really been a term that's been used through my career of about 40 years now. I think it's just still in the lay nomenclature, but really what we're thinking about with cataracts is it affecting function? So same sort of thing. If you have functional limitations, meaning you have more glare, maybe that's causing problems driving at night. Things are more hazy, lights are brighter, causing irritation. So functional limitations dictate the need for cataract surgery. So if somebody feels like they're doing great and has, reduced vision from cataracts, but they feel like they're doing fine, then that's not justified. But other people can have only mildly reduced vision. We have to remember when our eyes are checked in an eye doctor's office, it's sort of the most perfect setup. We've got, nice black letters on a white background and everything else, and that's not what the real world is like. So people can have functional problems recognizing faces, seeing in lower light situations and things that would justify having cataract surgery, even when their eye chart vision is still very good.
Let's take a quick break. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my student co-host Keith Garbarino. And today we're talking about low vision awareness with Dr. Mark Wilkinson. an optometrist, and a clinical professor with the University of Iowa. He is also a chair of the Low Vision Subcommittee of the National Eye Health Education Program at the National Eye Institute. You are listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. Early detection saved my life. It could save yours too. I was only 34 years old and the mother of 3 when I was diagnosed with breast cancer. I was forced to make a decision about my health with few options. After my treatment, I made a commitment to provide help and inspire hope to those affected by breast cancer through early detection, education, and support services. I was fortunate to have resources and support through my journey, but so many facing breast cancer have to overcome the burdens of cost and fear alone. No one should face breast cancer alone. Today, NBCF has provided over 1 million early detection and patient navigation services so that women in need have access to these potentially life-saving resources. To learn what every woman needs to know about breast cancer, visit nbcf.org.
We now return to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with my co-host, student of the Nursing Department, Keith Garbarino. And today, we're talking about low vision awareness with Dr. Mark Wilkinson, an optometrist and a clinical professor with the University of Iowa. He is also chair of the Low Vision Subcommittee of the National Eye Health Education Program at the National Eye Institute.
So, how you doing?
Good.
So something that you said that really stuck out was the 70% increase by 2030?
Yes.
So what would be a cause of this? Is this just related to the increase in elderly from baby booming, or?
Yep, it really is the aging population, just more and more people as we live longer, right? So it's interesting to think about age-related macular degeneration almost non-existent in 1900 because the average person lived to be 46. Uh-huh. Now as we live, 40 years longer than that, we have many more age-related eye conditions, and certainly where there's lots of research being done to try and figure out how to stop macular degeneration from advancing, to try and prevent that, say delay it from, instead of getting it at 75 to your 95 or something like that. But it's a multifactorial condition, and we don't have a way of stopping that. Basically, we need a little bit of a fountain of youth to prevent some of these age-related conditions from happening. Lots and lots of research is being done. The National Eye Institute is spending millions of dollars every year to try and prevent loss, prevent these losses of vision. But some of them still happen, and I think that's why the number is going to go up, is just the continuation of the baby boomers getting over the age of 65.
So as I age, I can almost expect for every time I go back for my annual eye exam that my prescription is going to get worse and worse.
Well, I wouldn't say that you could expect that. I think there's a time, from our 40s to mid-50s or so where we need a little bit stronger reading correction over time. There may be a little bit of change in your astigmatism correction, but then things sort of to level off for a while. And then, later 60s, 70s, that sort of thing, then people get to the point where they start to develop cataracts and will need cataract surgery. If all else goes well, obviously we hope you don't develop macular degeneration or glaucoma or any of those things. Certainly the vision can be pretty stable for a period of time.
So what is your thought about the eye surgery that corrects your vision if you have problems seeing far distance? Do you have any...
So refractive surgery,
yes.
that now is the most common surgery that's done. It used to be cataracts, but refractive surgery is the most common one.
What are your thoughts
for the most part? I'm sorry?
I'm sorry. What are your thoughts about that?
I think that it's good. I have a brother who had cataract or had the refractive surgery, and he's very happy with that. There are some problems with reduced contrast at night. So some people who have very demanding, visual needs may find that it makes their night vision a little bit harder. So that's something to pay attention to. Certainly wearing contact lenses would be something that would give you an idea of what that all would be like. But I think that refractive surgery continues to evolve and continues to get better, and it's certainly a good, viable option for many, many people.
So it's not a viable option if you're both near and farsighted, is it?
Well, you'd have to do monovision if you do that. So, meaning if you're nearsighted, can't see in the distance, but you have trouble focusing at near because you're 45 or older, so that's called presbyopia. The only option that they could do with that would be to correct one eye for near and one eye for far. That's called monovision. And that's successful about 70% of the time. So I would always tell people, try that in contact lenses first, because you don't want to find out after you've had it done that it's not going to work for you. Alternately, you'd have to just correct your eyes for distance vision and then put reading glasses on over the top.
So you still wind up with glasses.
Yep. Unless the monovision works for you, you're still going to need some glasses.
So even with this surgery to correct your vision, as you age, will it go back to its original state, or would it continue to decline, or how does that work after surgery?
It really varies from person to person. Mm-hmm. So there are many people I've seen who have very stable vision and don't need a distance correction. Other people, and we can't figure this out, but other people will go back to needing a pretty high correction again, even though they've had refractive surgery. And that's just how the eyes change over time. How the lens of the eye changes shape, how the shape of the eye changes as we mature, and so you don't know. So it is frustrating to think that you spent several $1,000s to have refractive surgery to not need glasses anymore, and you're back needing to wear them for distance, near, or both. But it certainly does happen, and there's just no guarantee to know.
Yeah. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with my student co-host, Keith Garbarino. And today, we're talking about low vision awareness with Dr. Mark Wilkinson, an optometrist and a clinical professor with the University of Iowa. He is also chair of the Low Vision Subcommittee of the National Eye Health Education Program at the National Eye Institute.
So we talked a little bit about some eye functions like cataracts and glaucoma, but we didn't really talk about preventative measures. I've heard about carrots or watching TV with the lights on, etc. Like, what would you recommend,
Well, the light thing is that's an old wives' tale. It's sort of like sitting too close to the TV, that's going to cause a problem. Most people are not nutritionally deficient to the point where, eating lots of carrots is going to make a difference. But certainly, nutritional problems can play a factor. People who, overconsume alcohol can cause problems with their optic nerves as well. So I think eating a reasonable diet is important. There are certainly lots of promotions of eye vitamins and different things that are out there, but I would suggest asking your eye care provider, what do they think about these things? The age-related eye disease study vitamins that are out are for people who are at high risk of developing age-related macular degeneration. And there's been no prophylactic benefit found for somebody to say, my parents had macular degeneration when they were 75, so I'm going to start taking that at age 40, and somehow that's going to help me. There hasn't been any science to say that will do that. So eating a reasonable diet is important. Green leafy vegetables we know are important. But for the most part, I would say, if you're outside a lot, I would definitely wear sunglasses, and I would wear a broad-billed cap if I'm out, doing that. Protect your eyes from excessive sun exposure. That's important. Eat a reasonable diet. Don't smoke. Smoking is bad for lots of different things. But some of these things are inherited and are multifactorial, like macular degeneration. So we can't say that if you do this or that, you won't develop some of these conditions.
So what would you say in terms of prevention if you have a job that really requires you to constantly look at the computer screen or do a lot of reading? How does it affect their vision?
Well, Well, there's lots of discussion about computer vision syndrome now, where people get eye strain and fatigue from computers, and it's interesting to think about how the workplace has changed from a generation ago, where people would sit at a desk and sort of look out across the room and everything else, and now people are in cubicles. They're staring at one or several computer monitors all day, and they tend to lose track of time. So one of the things that we say is either the 20-20 or 30-30 rule, which is every 20 or 30 minutes, take a 20 or 30-second break and look up, look across the room, look out the window, blink your eyes a few times, and then come back to what you're doing. All too often, people lose track of time, and they'll realize, I've been sitting here for 3 or 4 or 5 hours on my computer and never giving themselves a break. That's not permanently damaging their eyes, but it is causing eye strain and fatigue, and just making people more uncomfortable. So just paying attention to the fact of sort of good computer ergonomics. The other thing, as we get older and need to use a reading correction in our glasses, making sure that your computer monitor is a little bit lower and your chair is a little higher, so you're looking down through the intermediate part of the lens, as opposed to sitting there with your neck cranked back trying to look at something through the glasses, because that can cause lots of ergonomic problems as well.
Interesting. If one of our friends listening wanted to get in touch with you for more info, what would be the best way to reach you?
Well, I think, if they want general information, I would go to the National Eye Institute and just go to nei.nih.gov and then /low vision. If somebody wanted to get a hold of me directly, they could send an email to me at mark-wilkinson, WILKINSON, at UIOWA, so uiowa.edu. But there's lots of really good information at the National Eye Institute, part of the National Institutes of Health, and they have a variety of different information. Also, the NEHAP, NEHEP, the National Eye Health Education Program, has a number of videos, good testimonials about people dealing with vision loss, and lots of different resources there.
So, also, what is one parting thought that you would like to leave us with today?
Well, the big parting thought I would like people to know is that there is help for people with vision loss. So too often in the past, and I think some even today, people are told, you've got vision loss, there's nothing we can do, sort of go home and get used to it. And what typically they're trying to say, the provider, is that there's nothing medically or surgically that can be done to improve the person's ability to see, but there are lots of tools and strategies that we can use. Low vision rehabilitation looks at different devices, different adaptations that can be made to help people remain independent, give them the best quality of life possible. And so that could be different types of magnification devices, learning how to cook or navigate in different ways, keeping them driving, which is a big thing that I find myself doing a lot because I live in a rural state and we have people who want to be able to keep driving. So looking at those things. And what's interesting is there's lots of stuff you can do now with tablets, with smartphones, that just make life much, much easier. So if you have vision loss and you're struggling with things, ask your eye care provider for a referral for a low vision evaluation.
Thank you for being here, Dr. Mark E. Wilkinson.
You bet. Thanks for having me.
An optometrist and a clinical professor with the University of Iowa. He is also chair of the Low Vision Subcommittee of the National Eye Health Education Program at the National Eye Institute. So we know a lot more about low vision awareness than we did a half hour ago. So thank you so much, Doctor, again.
You bet. Thank you.
And this is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, along with my student co-host, Keith Garbarino. And we want to thank you, our listening audience, for tuning in to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.